नीम स्टोरेज फुल છે રેકોર્ડિંગ નહીં થશે
करूँ सर बैकअप में काम तो मैं चालू करूँ सर
यस ओके अच्छा आप लोगों में से किसी को भी कुछ डाउट है नस्य के उसमें आज सर नहीं है आप प्लीज अनम्यूट करके आराम से बात कीजिए एनीबडी हैज एनी डाउट otherwise we will start with certain other things regarding nasya only that what other nasyas we use as Shodhan nasya
हेलो
सब है या भाग गए हैं
हेलो है
ना
अरे है हम लोग है सब लोग है भागेंगे क्यों तो ज्वाइन क्यों होते हैं
पता नहीं ना अभी ओके
हेलो
अच्छा आप लोगों को कुछ डाउट है तो आप चैट बॉक्स में टाइप कीजिए अगर ऑन करके नहीं बोलना है आप चैट बॉक्स में स्टार्ट कर दीजिए अगर क्वेश्चन है रिगार्डिंग तो मैं ना हमारे क्लिनिक में जो हम लोग यूज करते हैं एंड इन माय 23 इयर्स ऑफ प्रैक्टिस व्हाट अदर शोधन नस्यर्स आई हैव यूज्ड मेरी आवाज इको एक ही बार क्लियर आ रही है
आ रही है
and I'll just leave and get in back because मुझे खुद की आवाज इको हो रही है ओके सो मेरे क्लिनिक में कटफल का पाउडर दैट आल्सो वी यूज एज शोधन नस्य we also have used त्रिकटु पाउडर एज नस्य प्लेन मरीच पाउडर एज नस्य मतलब प्रधमन की तरह फिर जैसे गुड़ शुंठी यूज करते हैं वैसे कुटकी और गुड़ का नस्य भी यूज किया है एक लिवर सिरोसिस की पेशेंट थी एंड शी हैड सिवियर जॉन्डिस तो उसमें हमने कुटकी का नस्य यूज किया था जैसे गुड़ शुंठी डालते हैं वैसे कुटकी एंड गुड़ का नस्य बनाया था सेम मेथड से एंड दैट यूज्ड टू हेल्प हर अ लॉट रिड्यूस हर बिलिरुबिन बहुत फटाफट उसका वो कम हुआ था then we use शिग्रुआदि तैलम in obstructive sleep apnea शिग्रुआदि तेल काफी सारी फार्मेसीज का मिलता है केरला की फार्मेसी का भी मिलता है एंड देन देयर इज अनदर फार्मेसी इन नासिक कॉल्ड एज ऊर्जा आयुर ऊर्जा या क्या है वो लोग भी बनाते हैं सो दैट गिव्स वेरी गुड रिजल्ट इन ओएसएस मतलब स्लीप एप्निया में देन शमन नस्य में इंसोम्निया के लिए वी यूज बफेलो घी rather than using cows घी बफेलो घी वो क्यों यूज करते हैं वो एक के बाद एक आई विल जस्ट से आई एम जस्ट गिविंग अ ब्रीफ कि हम और क्या क्या यूज करते हैं एक्सेप्ट शुंठी एंड एक्सेप्ट GGS या 5GB which we have already spoken आगे के उसमें हार्मोनल इश्यूज जो सारे होते हैं उसमें हम लोग पंचगव्य घी शुंठी घृत एंड महाकल्याण घी बहुत यूज करते हैं नस्य के लिए देन एक मिनट है अणु तेल षडबिंदु तेल तो ऑलरेडी आप लोग जानते ही है विच आर यूज आई हैव इवन यूज्ड सूतशेखर का पाउडर फॉर प्रधमन नस्य so these are other general things that we have used in the clinic would you like to know specific usage of each and every nasya dravya then we will go ahead otherwise I'm just mentioning कि हाँ ऐसा ऐसा use किया है करके and you can share if you want to share if you have used any other nasyas
we want to know yes okay. Please tell us
okay so कटफल नस्य जहां पे भी कफ प्रधानता है एक्सेसिव साम कफ है शुंठी ऑल्सो डजंट एक्ट दैट वेल, एंड जिनको शुंठी से बहुत ज्यादा छींके आती है या बहुत ज्यादा जलता है, उनको हम लोग कटफल का नस्य देते हैं एज प्रदमन। कटफल का प्रदमन देने के बाद ना जलन इतनी यहाँ पे नहीं होती है, लेकिन वो जब ऊपर पहुंचता है ना तो कफ का रेचन बहुत ज्यादा प्रमाण में करता है। तो जिनके उसमें ऐसा केस है कि कफ एंड वायु, कफ प्लस 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 एंड वायु सेकेंडरी, वैसे वाले केसेस में वी हैव गिवन कटफल नस्य, वेर वी नो फॉर वेरी everybody can
बराबर
hear the
चचा।
sound.
यस यस, वॉइस इज क्लियर।
जयश्री मैडम एक वक्त लीव करके आप फिर से ज्वाइन कर लीजिए, आई विल वेट फॉर यू टू रीजॉइन। जयश्री मैम आवाज आ रही है आपको? So Ashish sir has also joined. Hello sir. We were just discussing what other Shodhan Nasyas we use in our clinic. Good evening sir. सर का ध्यान नहीं है। हेलो सर।
नमस्कार नमस्कार
नमस्कार सर, we were just discussing what other Shodhan Nasyas we use in our clinic.
yeah.
So we just started with that list and I was just explaining Katfal Nasya. So Katfal Nasya in heavy sinusitis, drowsiness, तंद्रा है, कोमेटोज पेशेंट है, उसमें कटफल नस्य यूज किया है। हॉस्पिटल में एडमिटेड पेशेंट जो कोमेटोज है उसमें कटफल नस्य का एवरी आवरली भी दिया है। शुंठी के इन ल्यू ऑफ शुंठी, मतलब शुंठी इजीली अवेलेबल है एक बात है, लेकिन व्हेन यू हैव द अवेलेबिलिटी आई हैव इवन यूज्ड कटफल नस्य। सिमिलरली त्रिकटु पाउडर आल्सो वी हैव यूज्ड in clinic setup, as well as we have given it to patients who have severe sinusitis, severe headache, कफ वात जो शूल रहेगा उसमें, even in case of severe tonsillitis त्रिकटु नस्य यूज किया है। इट इज वेरी वेरी तीक्ष्ण एंड उष्ण एज कंपेयर टू शुंठी। इनफैक्ट त्रिकटु और गुड़ का जैसे शुंठी गुड़ बनाते हैं वैसे भी बनाते हैं, जिनमें 16 ड्रॉप्स में भी सपोज शुंठी गुड़ का नस्य आपका पहुंचा नहीं है, शुंठी का डबल डोज करने के बाद भी वो ड्रॉप्स 16-16 या 20-20 में भी नहीं पहुंच रहा है ऊपर, इन दोज केसेस यू कैन यूज त्रिकटु एंड गुड़ का नस्य। त्रिकटु एंड गुड़ का नस्य एज अ ड्रॉप फॉर्म में इट इज ऑल्सो गुड इन पेशेंट्स हु आर हैविंग जॉन्डिस, लिवर सिरहोसिस है, वैसे वाले केसेस में ये काम करता है, बहुत अच्छे से काम देता है। In fact, in patients who have high cholesterol, in them also त्रिकटु गुड़ नस्य works very well. कहीं पे भी आपको प्रमाथी एक्शन चाहिए, सिर्फ not only in this area, but overall in the body, wherever, example, there is accumulation of fat in the liver or there is accumulation of fat in the pancreas, fatty liver, fatty pancreas, वैसे वाले में भी त्रिकटु गुड़ नस्य that works well. But please look at your patient. If he has excessive पित्त प्रकृति है या पित्त दोष बहुत ज्यादा है, then you cannot use त्रिकटु नस्य in that, either in the शोधन form or even in the drop form वैसे। Then kutki nasya, kutki ka powder, as pradhaman also I have used, but pradhaman I have rarely used. I have used more of kutki and gudka nasya. That was in jaundice ka patient, and it used to actually reduce the icterus immediately. Matlab after putting 6 drops, 8 drops, and when the patient used to cough out the phlegm, it used to actually reduce the icterus, and the patient used to feel very much better. Another usage of Trikatu Pradhaman is in nasal polyps. Even the Trikatu Gud Nasya helps in polyps. Then Shigruadi oil. Shigruadi oil is specifically used more in our clinic in patients who have obstructive sleep apnea. It works in the nasal polyps and obstructive sleep apnea वाले patients जो रात को माउथ ब्रीदिंग करते हैं, एडेनॉइड्स है, जिनको नेजल पॉलिप्स है, and who do not sleep well the whole night. So when in those cases there is excessive drying of the cough which is there in this area by the vayu. So we need something which is oleating also, which will penetrate deeper. मतलब गीला करके वायु, मतलब कोई तेल या घी बेस्ड ही कुछ यूज करना पड़ेगा उसमें. So we alternate it with a oil or ghee based nasya, plus we use a pradhaman nasya after that. So in our clinic what we do is, in such cases we give panchagavya घृत nasya, and then after 30 minutes or 15 minutes we ask them to put shunti pradhaman. Or in cases of patients who are having कफ बट पित्त का प्रमाण भी बहुत ज्यादा है उनमें. बट इफ इट इज अ प्योरली वायु एंड कफ का केस, दोष प्राधान्य आपको दिख रहा है, तो इन दोज केसेस वी यूज शिग्रुआदि ऑयल नस्य एंड इट वर्क्स वेरी वेल. The patient itself, second third day quality of sleep improves. ऑयल बेस्ड नस्य है तो वो क्या करता है, द मोमेंट यू पुट इट, वायु का रुक्ष जो नेचर है उसको कम करता है. इट पेनिट्रेट्स डीपर बिकॉज इट इज अ वेरी तीक्ष्ण नस्य. शिग्रु आदि तेल के जो कंटेंट्स है दे आर ऑल तीक्ष्ण द्रव्य. सो दे पेनिट्रेट डीपर एंड दे गो एंड एक्चुअली पोर में जाके जो लीन दोष है, जो कफ सूख गया है लेयर्स एंड लेयर्स, that gets eradicated and that starts coming out. Basically how we are using the concept of nasya in obstructive sleep apnea is like, जैसे हम बॉडी में भी कैसे स्नेहन करते हैं, स्वेदन करते हैं एंड फिर दोषों को चलायमान करते हैं. सो कंसिडर पुटिंग एन ऑयल, तीक्ष्ण ऑयल नस्य ओवर हियर एज अ स्नेहन, एंड देन व्हाट यू आर डूइंग इज लाइक हाउ हम पंचकर्म में जैसे घी पिलाते हैं एंड देन वी ट्राई टू गेट ऑल द दोषास इनटू द कोष्ठ. Similarly, all the doshas, because of excessive vayu, all the doshas have gone into the periphery of the urdhva jatragat area. So they go and they stick onto the walls, onto the tissues. They go deeper into the tissues of the brain cavity or into the sinus cavities or into the blood. मतलब सूख जाते हैं, उनके layers बन जाते हैं. तो जब हम कोई भी ऑयल बेस्ड या घी बेस्ड नस्य देते हैं, irrespective, not just obstructive sleep apnea, but whenever we are giving any kind of oil or ghee based nasya, whether it is shodhan or whether it is shaman, what it does is the moment it oleates, जैसे ही वो स्नेहन होता है, वो वहां के जितने भी दोष है उनको इमल्सिफाई करके निचोड़ के निकालता है वहां से, and it gets into the circulation and then you get this sensation नाक से निकलने का या गले से निकलने का. आप लोगों ने खुद ने जब भी नस्य डाले हैं तो have you experienced where does the nasya travels? Plain shunthi gur nasya also, has anybody experienced where it travels? I am asking anybody, it's an open question, please unmute yourselves and answer.
पहले आंखों की तरफ, पहले नाक में जलन होती है, फिर आंखों की तरफ जाता है, फिर थोड़ा आईब्रोज में. मुझे जब मैंने किया था तो पहले मेरे तो आंखों में से पानी आया था, फिर थोड़ा सा आईब्रोज के ऊपर वाले एरिया में मुझे लगा कि यहाँ पे पहुंचा है, एंड देन साइड वाले एरिया में मुझे पहले लगा, एंड देन फिर फ्रंटल एरिया में लगा. इस तरीके से मुझे फील हुआ था जब मैंने खुद ने किया था. पहली बार मैंने किया था,
ड्रॉप्स में फील हुआ था?
मुझे ये 8 से 10 ड्रॉप लगे थे फर्स्ट टाइम जब मैंने किया था.
ओके, एनीबडी एल्स?
मैं रोज करती हूँ ये गुड़ शुंठी एक्सेप्ट ऑन संडेज, और मेरे को 2 महीने हो गए कि मैं हर वीक में हर 5 मतलब 6 days a week फॉर द पास्ट 2 months हैव बीन डूइंग. और मेरे को अभी भी दोनों नॉस्ट्रल्स में 10-10 बूंद लगते हैं. उसके बाद मैं मतलब आई पुट 20 drops एवरी डे. जलन सिर्फ नाक में होती है, अभी तक ब्रेन में पूरा जाता नहीं है, मतलब वो फीलिंग नहीं आती.
Have you tried putting 16 drops? मतलब at least if it reaches up till this line.
16 drops per nostril.
So one nostril, two,
yes.
2. So you have to count one nostril only 4, then 2, 2, 4, 2, 2, 4. So right nostril का separate and left का separate आपको गिनना है.
हाँ, तो वैसा मैं राइट नॉस्ट्रिल में 10 हो जाते हैं और लेफ्ट नॉस्ट्रिल में 10 हो जाते हैं. मैं 2-2 करके ही डालती हूँ. till it reaches. हाँ, but मुझे यही लगता है कि अभी तक शायद मेरा बहुत ज़्यादा दोष accumulate होंगे, क्योंकि मेरे को रात को सोते समय सिर बांध के ही सोना पड़ता है. Whenever I am in a supine position, I feel a heaviness in my head, and this is since many years. So I always have to tie some cloth tight, and I feel better when I tie it. So I think my doshas are accumulated in the nose. And previously, when you had asked me to put this Panchagavya Nasya, so I was putting Panchagavya in the night and Gud Shunti in the day. तो मेरा ये एक्सपीरियंस था कि पंचगव्य डालने के बाद मेरे को बहुत बार उठ के फ्लेम मतलब कफ आ जाता था ना, और मुझे बहुत थूकना पड़ता था. गुड़शुंठी के बाद नहीं होता था, लेकिन गुड़शुंठी दिन में डालो और रात को पंचगव्य डालो तो बहुत कफ निकलता था. और मतलब 2-3 बार उठ के नींद में से भी मुझे जाना पड़ता था. एंड मुझे ये भी रियलाइज हुआ कि मेरा डायूरेसिस बढ़ता था पंचगव्य से. मतलब जो मैं पानी इतना पीती भी नहीं हूँ, लेकिन मुझे डायूरेटिक इफेक्ट उसका लगा. आई वॉज वंडरिंग हाउ इट हैपेंस. It was marked in a marked way. I had to go for urination. I don't know. I can't explain why.
I will explain you the whole process what was happening. Ashish sir, आप पहले बोल लीजिए. Then I will explain what was happening.
Yeah. Yeah, I just wanted to ask her whether she has checked her BP. Any chance? Are you having hypertension?
Yeah. No. My BP is always like 120 or 130 by 70 or 80. That's it. Every time.
By diastolic is how much?
70, 80.
70, 80. Okay. And was there any past history of pratishay or Jirna pratishay or something
Never.
like that? Never. Okay.
Never. And I have never taken any anti-allergics or something to suppress my cold. I don't even have frequent attacks of sardi.
And have you tried Pradhaman by any chance? Simple Shunti Pradhaman?
I tried it, but it always sticks to the nasal mucosa, and it doesn't go as deep as Shunti Pradhaman. So I stopped using Shunti Pradhaman.
Acha. And who is putting for you, like in the clinic? Your
My
assistant puts?
Yeah, my assistant puts it. I have instructed her, and I make sure that the position is 100% all right.
Okay.
It goes in the sinuses only after 20. When the drops reach 20, I feel it in the higher up, and in earlier it feels only in the nose.
Okay.
And
Just try out with.
One more thing I want to mention is, whenever I go out in the sunlight, I sneeze at least 6, 7, 8 times. Hamesha, I just cannot go without sunglasses anytime. I am totally मुझे थोड़ा सा 1 किलोमीटर भी अगर मैं गॉगल भूल गई तो मेरे को गाड़ी रुक के आई हैव टू सी टू इट दैट कि मैं गॉगल पहनूं या टोपी पहनूं, और मेरे आईज को, नहीं तो मेरे को एक हाथ से कवर कर करके चलना पड़ता है. आई जस्ट कांट वेयर द सनलाइट. मेरे को छींके ही आती है.
Just want to clarify whether there is any other symptoms like photophobia, or you start immediately sneezing after getting in the presence of sunlight.
Immediately as I step out from the home, अगर सनलाइट है, बहुत बहुत स्ट्रॉन्ग सनलाइट नहीं है, समझ लो मैं मॉर्निंग वॉक के लिए अगर 6:30-7 बजे निकली तो भी पहले 3-4 बार तो छींकना है ही मुझे.
Okay. And what happens if you step out from the home in the evening when there is no sunlight? तब भी छींक आती है कि नहीं आती है?
नहीं आती, तब नहीं आती.
Okay. Okay. I don't know, but then what I usually suggest in such see, sunlight में कफ का विलयन होता है और वो छींक आती है, ऐसे we can put it, but then Other thing what is also striking to mind is if you can do just rolling around your inner part of nostril with simple til oil or simple ghee. Okay, then when you
Yes.
step out, irrespective whether there is sunlight or not, those whatever allergens or whatever particles they are about to insert inside and then can stimulate and can create problem, that will get adhered to that the initial level itself. So whether you call it and rationalize it from modern side or you call it as a pratimarsha, whichever way you wish to, try doing that, number one. And secondly, if it is possible to apply lap onto your forehead and paranasal sinuses with simple as vacha stick and shunti 4:1 proportion.
Okay.
And once it gets dried up, then give सेक ऑफ अजवाइन का पुड़ी, अजवाइन
अच्छा
को हैंकरचीफ में रखते हुए वो पुड़ी को हॉट प्लेट में गरम करके फिर दो. नॉट टू सेक अजवाइन डायरेक्टली, अजवाइन हैज टू बी इनसाइड कपड़े का पुड़ी
ओके
खिड़ी. So try
okay.
out
Vacha
that. And
sunti
the
mein
other thing,
vacha for vacha 4 and sunti 1, is it?
sorry,
vacha sunti में vacha और sunti का proportion ratio
vacha
4:1.
vacha 4 part, shunti 1 part.
अच्छा okay okay.
Huh? And to be
Yes.
not to take powders, because many a times many other colleagues or even patients, they come saying that sir, we have tried and we got no result. But then when you cross check whether you have done that paste or have you used powder and created paste, in powder it is not getting any results because it is not microfine. Whereas when
अच्छा
you actually just rub it on that rubbing stone सहाणेवरती आपण उगाळतो,
oh
then the outcome is something different, which I have seen in a number of cases.
अच्छा okay. For good shunti you are
And
saying,
huh?
for good shunti you are saying.
No, you are getting confused. I am saying लेप
Okay,
लगाने
for
वाली बात,
lip. Okay, okay,
forehead
got
and
it.
paranasal side.
Okay, okay, got
गुड़सुंठी
it, got
की
it.
बात नहीं कर रहा हूँ. Okay.
Okay,
And in spite of using 20 drops or 10 drops, whatever you said, you just try once very little amount of tricatu. Just now abhi Heema madam has also spoken, so just try very little tricatu, then close one nostril and take deep in,
अच्छा
and you can then reply your feedback maybe tomorrow or day after.
okay sir, okay.
But बहुत ज़्यादा भी नहीं लेना, because another part of tricatu, that is vyosha churna, कभी कभी वो लेते हैं तो sometimes, very rarely I have come across only 1 or 2 cases, if they are very typical pitta predominant and ज़्यादा amount में ले लिया अंदर, then some of them they have come out with slight bleeding. तो ऐसे समय में again you have to hold it and just अपना simple ghee,
अच्छा
and इतना बहुत ज्यादा तो टपकने जैसा नहीं आता है, so don't worry, not to worry.
अच्छा okay.
Right? Yeah,
Okay,
Dr.
thank you.
Heema, you were saying something.
So Charubin, you said that after putting the ghee nasya, you felt that there was excess urination, मतलब more urine. What
Yes.
happens when you put the nasya? It creates the anuloman of vayu, not only in this area but throughout the body. That's why you have extra urination. This is not just the case only with Ghrita Nasya. This happens with oil Nasya also. This also happens with Shunti Ghrita Nasya. Like how we have anuloman of vayu through laxation or any procedure like basti or by proper pachan. Same way, when we put nasya over here, the vayu which is obstructed in this area gets cleared. There is anuloman of the vayu. There is anuloman of the doshas. They start moving in the channels properly. So then there is a dynamo effect on rest of the body also, rest of all the vayus. One vayu will affect the other vayus. Example, if you take your body as a tubular structure, like a big tube.
थोड़ा समझना डिफिकल्ट पड़ता है, लेकिन बोलते हैं ना इंसान खाता है ना, खुद ही कुछ पता चल जाता है। ये जैसे खाता है, केला खाता है तो देखो।
Okay. So in that tube structure, if you consider that your apan vayu is here, your saman vayu is here, your udan vayu is here, your pran vayu is here, and overall there is vyan vayu. So what happens if you give one push to this vayu, it will affect all the other vayus. Similarly, if there is any effect on the periphery, this vayu, then also it will affect the rest of the vayus. If there is any effect on the top vayu, it will again affect the other vayus. Same way, if there is any halchal in between vayus, it's going to create some pressure here and there. The only openings that we have, ऊपर का जो प्राण vayu है, that has an opening. Apan vayu has an opening. Rest both the vayus are truncated, they are in here, right? So what happens, these vayus are easier to control, the apan vayu and the pran vayu, they have direct access, and vyan vayu locally if you apply anything. Now the moment you apply, you put nasya, because you put panchagavya grit, what happens, whatever, in your case it is exactly a condition where all your kapha has dried up in the system because of excessive dryness of vayu. You basically would not be having very good sleep since long years, only then this case can happen. So there is yes, Charubin, you want to say something?
Yes, lack of sleep is a major problem.
Yes, this is a very typical condition. So what happens when you put the Panchagavya Grit Nasya, whatever Vyan Vayu ka rukshata hai, jitna bhi rukshata hai, that starts reducing the moment you put Panchagavya Grit Nasya. It actually first reduces the rukshata of the Pranavayu. Then it reduces, what it does is, it starts oleating the kapha. So वो कफ गीला हो के बाहर निकलता है, तो वो प्राणवायु को और घूमने की जगह देता है. Once that circulation happens, it gives a domino effect to the Vyana Vayu. It also gives a domino effect to your Udan Vayu, to your Saman Vayu, to your Apan Vayu. Because it is also oleating all the other Vayus. मतलब सारे वायुओं की रुक्षता कम करता है. आपका जो व्यान वायु है, जिसकी पूरी एक्शन ऐसे ज्यादा बाहर है, और आपकी स्लीप क्योंकि बराबर नहीं हो रही है, तो ये एक्शन और ज्यादा बाहर की तरफ है. जैसे ही आप घी डालते हैं नाक में, दिस एक्सेसिव आउटवर्ड एक्शन जो यहाँ से ऐसे होती है व्यान वायु की, दैट बिकम्स इन लेवल. तो वो क्या करता है, जो बाहर की तरफ फेंका हुआ जो भी ड्राई, मतलब इवन आपका ना बॉडी में हल्की स्वेलिंग होगी, वो भी कम हो जाती होगी द मोमेंट यू पुट पंचगव्य घृत नस्य. इट कैरीज all the doshas back into the capillaries, from capillaries to the veins, then it gets it into your central system, then it goes to your क्या बोलते हैं, it will throw it out through urination. If you want to know about modern way से, the moment you put the nasya, जो वातवह नाड़ी ऐसे हम दिखा नहीं सकते हैं, but if we say your vagus nerve gets stimulated, and vagus nerve has innervation right up till your 2/3 or 1/3 of your transverse colon. I think Snehil knows it far better, the anatomy, but vagus nerve has that much of innervation right from the cranial nerve जो निकलती है, वो throat को, larynx को, diaphragm को जाते जाते right up till the transverse colon, that innervation is there. So that's how the impulse goes, and then you get either you will pass gas also. Lot of patients say that आपने नस्य डाला तो हमको नीचे से गैस पास हुआ, नस्य डाला तो हमको यूरिन ज्यादा पास हुआ, नस्य डाला तो हमारे पेट का ब्लोटिंग कम हो गया, नस्य डाला तो पेट में जो दर्द है, वो टेंडरनेस है, वो कम हो गया. Now how does this happen? मतलब patient themselves say, there was an allopath doctor who comes to my clinic, she said that उनको तो हमने सिर्फ आई ड्रॉप्स डाला था, आई ड्रॉप्स डालने के बाद शी इमीडिएटली सेड वो मेरे पेट का दर्द कम हो गया एंड माय ब्लोटिंग हैज गॉन. वी नेवर थिंक इन एलोपैथी मेडिसिन कि कोई आंख में दवाई डालेगा तो पेट का ब्लोटिंग कम होगा. सो imagine the impact of nasya that you are doing. You are putting the medicine only in the nose, but it does not act only in the urdhva jatrugat area. The action is throughout the body. There is a paper on Nasya written by a modern A. I will send the link of it, that how it acts within less than 30 seconds. It starts acting, it crosses the blood-brain barrier, and how it gets absorbed. So you can go through that paper, but in short मैं वो paper समझा देती हूँ. I will send the link on the group. The moment you put it, वो अंदर का जो mucosal membrane है वहां से वो absorb होता है. अंदर absorb थ्रू द ब्लड जो कैपिलरी है वहां से तो अब्सॉर्ब होता ही है, प्लस द नर्व्स आल्सो गेट स्टिम्युलेटेड. दिस देन क्रॉसेस एंड गोज इनटू द sinus, cavernous sinus, and then it gets distributed into the whole blood brain. ब्रेन का जो भी ब्लड सर्कुलेशन है उसमें जाता है, एंड देन इट गेट्स ड्रेन्ड इनटू द जुगुलर वेन. This action hardly takes 20 to 30 seconds once any medicine is delivered through the nose. This paper was published for nose drug delivery, nasal drug delivery. So agar unka medicine which is dry, which is not even oil based, it was for a water based drug and in mist form, uske liye ye paper publish kiya tha. Now if we look at a lipid based, जैसे अपने घी और ऑयल का है, the absorption is quite faster, but we have to select SAM and NIRAM condition and then only deliver a grit based or a oil based Nasya. Otherwise initially to clear up the passages we have to use something like a Pradhaman Nasya. In your case Charusmita Ben, I think you should start with the Panchagavya Grit Nasya in the morning, so that it does not disturb your sleep, and after 30 minutes of it you just do a Pradhaman Nasya. Don't do Shunti Gud Nasya. You can just start with that.
I have also found that Panchagavya Grit gives me a very good quality sleep. So if I put it at night versus if I put it at day, there won't be any difference.
You can try it a little bit earlier. You can put it twice a day also. Morning you can put Gud Shunti, you can put Shunti Grit Nasya, then you do a Pradhaman Nasya, and at bedtime you put Panchagavya Grit, but at least 1 hour before your sleep, so that you don't have to get up to spit out the phlegm after you have gone off to sleep.
Okay. But Shunti, you please share the preparation of Gud Shunti Grit Nasya.
I will share it on the group.
Yeah. Thank you, Heema. Thank you.
Okay. Avdut, and please add whatever points are missing in this or whatever I might have forgotten to say. Then we'll move ahead. Maybe Dr. Dattatreya will share a case or something, and then we can take it more ahead.
I just wanted to add one thing. In Dr. Charusmita's case, she is getting sneezes mainly in the sunlight, right? And when she covers the eyes or when she is wearing cap, the sneezing is less. Is that right? Yeah.
Yes.
So
Yes.
can we think of something with the eyes also, like anjan? And maybe if the samata has been reduced, then we can think of a anjan with a grita base along with the nasya. So the entry is through the eyes. So the main sensory, or what we can say, the main reception is through the eyes, mainly the light, and that is causing sneezing. So this may not be the pratishtha only. This is something with the eyes. I think Ashish sir would be guiding well on this.
Which anjan to put, sir?
Ashish sir, you please.
I think, see, in her case, na, I think she has a very high pupillary reaction. The ciliary muscles are working very strongly, reacting very strongly to the sunlight. So I think it is more like a spasmodic action. The moment the sunlight is hitting, there is a spasmodic action, or what do you say? Not spasmodic, but a relaxation action, so that not more sunlight should go inside. That could be causing triggering. But so again, it is Vayu based. So anything which is Grut Nasya should help. Anjan sir can guide.
I think in this now, what necessarily I felt, another thing stuck to my mind while listening to entire conversation is like there is something, and along with this, apart from sneezing, she has got headache. That is what she is saying again and again, right? So I just wanted to confirm from her that headache is throughout day or only at bedtime. And you said you have to tie your head, forehead, and all. So what is the status?
So generally it is at bedtime. I feel heavy, very heavy. I have to inhale Amrutanjan and I have to tie my head. Then I am able to go off to sleep. Rest of the day,
Okay.
there is
Not
not any
time.
noticeable.
Whenever you are
Pardon?
moving out in a sun, there is no pain, na, that moment.
No, 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 no.
Only at night.
Yes.
Okay.
I think that night pain again, it indicates spasm. Vayu se sankoch hoke everything gets heavy because the srotasas are getting smaller. So I think the ghee nasya then actually it is soothing out that spasm.
This it is slightly other way around. I differ a bit on this because when it comes in a bright light, then pupillary reaction, like because of act of accommodation, pupil will get constricted. That is understood. That is okay. But when you enter inside dark, particularly night, may it will be dark. So that time the pupillary size would have been dilated, not the constriction. So I
No, I'm
don't
not
know whether
talking
should we
about,
call it.
sir. No, in the evening, all the channels over here would get smaller, no? The srotasas,
Get
all the
shrink
srotas
because
will
of the,
strengthen.
yeah, yeah. That I agree. That I agree. But in the daytime, when she goes out and she gets, she can't bear that light sensitivity. That is what is typically photophobia. So one need to actually get into more details whether it is moving towards any other, ocular problem. Have you ever showed yourself to nearby ophthalmic surgeon or ophthalmic
Yes,
consultant?
yes, yes, yes. I have been to an ophthalmologist, but
Hmm.
my number is also very like point.
No, not for number, but just as you
But
done any
there is a lot.
fundoscopy or
Fundoscopy has
sorry.
not been done, but
Oh,
there is no फंडोस्कोपी का कभी जरूरत ही नहीं पड़ा डॉक्टर को ऐसे बताने का मतलब there was this thing is just related to the sunlight, otherwise I don't have any problem with the eyes. And the one more thing is a lot of watering from the eyes at any moment, like my eyes start watering very quickly. So what I thought about it is a lot, there is a lot of congestion in my urdhva jatrugat area. That is what my inference is for some reason
yeah.
or the other. And the pitta or vayu is not able to is not letting the doshas to come out. They are drying up the secretions. That is what my interpretation is.
Okay. Should we now, सर आगे आप कुछ बोलेंगे क्या करेंगे?
We have not covered vacha, na?
Vacha
Have we
Pradhaman we
covered?
have not covered. कटफल त्रिकटु
Covered?
कुटकी शिग्रु आदि इतना तक हुआ.
हाँ.
बफेलो घी बाकी है, पंचगव्य घी, शुंठी घी बाकी है, वचा भी बाकी है. सर आप वचा ले लीजिए, बाद में अवधूत पंचगव्य घी GGS whatever you want to say.
It means Vacha Churna Pradhaman we have done in many occasions. On road also I have done along with mother. My mom is also doctor, so we have given Vacha Pradhaman on a case who had unconsciousness and on road, and immediately it takes the patient back. And luckily घर में था, मतलब बचा नहीं होगा हाथ में तो you can't do anything, but then it was there available. Vacha tail is also available, but make sure Vacha tail whenever you are using, you should not use it in a larger quantum because it's a very very tikshna Vacha tail. So if at all it is very specifically indicative, then and then only we must go. Or I have seen in some parampara they are diluting it and using it, not directly. But again there is a debate on that. I call upon my other colleagues to comment on that.
Sir, dilution with what? Tilda?
Dilution with I've seen with some Vruddhavidya parampara using, though I have never done in my practice, but then I've seen people are using 1 part vacha tail and 3 part or 4 part tila tail, and rigorously mixing and then using, so that the tikshnatva can be managed. But then my question in my mind then to that sir also, then why are we using it? Because if we want for shodhan, then why do we dilute it to that extent? But then he says no, in our tradition we use that way. There was no very specific answer to that. But then vacha can be used, but can be kept as a reserve. Usually we manage with these common things. Anything else which we have left out in shodhan?
नहीं, शोधनना लिस्टમાં ચેક કરને. Then બાકીના બફેલો ઘી બાકી છે. Then shuntigrit is remaining, and what else? One more nasya. अवधूत तेरे उसमें महाकल्याण घी है. Then अपना वो नस्य के स्लाइड में से और कौन से बाकी रह गए हैं, और बाकी तेरे पर्सनल प्रैक्टिस में से भी कोई है तो वो
अणु तैलक है, षडबिंदु तैल है.
अणु तैल है, करेक्ट. Yes. अणु तैल is left.
Yes.
Okay, one more thing I am using in particularly my practice, that is Panchendriya Vardhan tail, and I have used it in n number of cases. Again, Panchendriya Vardhan for various kinds of cases related to eyes, related to even nose, and very rarely 1 or 2 I remember in case of Karna. But Panchendriya Vardhan, which is available by Nashik Seva Sangha, they have that particularly green and yellow colored pack, and that formula is actually not classical formula. It is not from any Ayurvedic text, but it is given by one Jain Muni, and that formula Vaidya Bindu Madhav Shastri, he received it and he found it is really helping in number of cases. So then finally he took permission from Sadhuji, and then he allowed, and then the company has started preparing it. So it's again
it has yoga. It has Shastradhar from Kashyap Samhita. Kashyap Samhita, Khilasthanam. Yeah. And in that it is Panchabhautik Taila. उसका नाम पंचभौतिक तैल है, and the prabhav is Panchendriya Vardhan. So the company has taken Panchendriya Vardhan as the trade name, and it has the same formulation.
One of the article written by himself, Bindu Madhavji, and in that he has mentioned. So I am saying on the basis of that article, but we need to cross check him. I mean, if you have got, kindly send it across. I will go through the other part.
Good sir, if you have any cases to discuss,
Yeah,
your
not the
experience
cases,
about the
but
Nasya.
since we are talking about Panchendriya Vardhan, I just wanted to make it clear. So, Panchendriya Vardhan is basically Shaman Bruhan Nasya, right, sir? Yeah. So, the contents are also Jivaniya Dravya mainly, then Punardava Manjishta, so the Rakta Prasada Gan is there. So, mainly it is Shaman, and if used in larger quantities, we can think about Bruhan also. So, mainly Vatach conditions, and I have used in degenerative. I had used in Parkinson's. It was not the only treatment, but any degenerative condition of brain, I have used this Panchendriya Vardhan Telnas.
There is one, whether your time is right to put the particular Nasya or no. See, the same Nasya, Panchendriya Vardhan Nasya, if you are putting, or even Anu tail, if you put it in a stage where Shodhan and Shaman is required, if you put the oil, it gives a burning sensation in the nose and all this area. But if you put the same Nasya in Shaman and Bruhan stage, the same Nasya gives a very cooling effect. So if you ask the patient, you yourself will come to know that after putting this, what is the sensation that you get. So this is another way to find out which stage the patient is in. And this is very commonly seen in all the Nasyas. Like, I had a patient for whom we had put neem oil for 30 days. And that patient we had put neem oil for premature graying of hair. It is a textual reference from Vagbhat, Rasayan Chikitsa Adhikar. So we had put that, and when we gave this particular patient, to put the Nasya, the patient had excessive cool feeling. And in another patient, we put it, but we misjudged the timing. So that same patient had burning feeling. The other patient had burning feeling when we put the neem oil for this Rasayan. So that is how you can judge, whenever we are putting whether we are putting the Nasya, but the medicine itself decides whether I want to do Shodhan, whether I want to do Shaman, or whether I want to do Bruhan. Even if you misjudge, sometimes the medicine itself decides. I think Avdut also must be having this experience.
Yes, yes. Many times patients discontinue the Nasya because they say that it is very burning. So initially I used to get confused. So why it is happening that the same Panchendriya Vardhan Tel Nasya was working for other and the patient was happy, and the other patient says it is very much burning. So that time, what Heema told just now, that Shaman stage is there, then the burning is less, और सामावस्था the burning would be more, and patient discontinue, patient डालते ही नहीं, वो सिर्फ ट्रीटमेंट दवाई लेने के लिए आते हैं, नस्य वो डालते ही नहीं है फिर. Yes.
One more thing I would like to add is, if you select very much wrong Nasya, if the patient is in Shodhan condition, but if you are putting Bruhan Nasya by wrong selection of drug, or very much likewise if you are selecting the drug, then that drug will not go into the head, but patient will feel that drug is going into the throat directly. Being the position right, still, because the pathway is not open, Shodhanasya, what it does is it opens up the strotasas from nose to brain. If the pathway is not open, the strotas is not open, that ghee or that oil will not penetrate. It will directly go into the throat. That is the personal experience, and that also indicates that the selection of Nasya is wrong sometimes.
Also, Snehil, share the pathway that you felt. There were times when I used to describe that, okay, the Nasya, when you put, it travels like this way, like this way, like this way, and over here. And Snail used to laugh at me. What rubbish are you talking? Aise kabhi jata hai Nasya? Then I had spoken to to Snehil and all the other doctors in the clinic that जब भी आश्वासन डालते हैं ना तो this is the pathway, this way, this way, this way, how it goes. And believe me, when I read that paper on nasal drug delivery, I was like, these people need lakhs of rupees just to write this research paper. If somebody gives me, I can tell it by what I'm experiencing. And Snehil was laughing at it. And few days back, Snehil told me, मैम आज नस्य डाला ना तो ये सच में इधर से इधर से इधर से ऐसे गया. एंड आई वाज लाइक ओके, अब तुमको भी समझ में आया, अब बताओ.
Initially when I started with Nasya, maybe 8 years back, 8 to 10 years back at Sir's clinic, Lala Sir's clinic, when I used to take some medicines. So Sir used to put 20 drops, 20 in each nostril, and it used to reach just here for 6 to 8 months. So Charusmita ma'am, don't worry, it's just a 1 month and drops are not going in 10 drops. It used to go just till this part for 6 months. After that, channels opened up, and now when I put in between, whenever I put the Nasya, it goes in 2 drops here. So once in a 1 week or 2 weeks, I just put good Shunti Nasya just to check the channels are open. It reaches in 2 to 6 drops maximum. So once the channels are open, it will remain patent if you take care of it. So, but initially it takes time. And once, as ma'am said, last week, once when I was putting good Shunti Nasya, and generally it goes from nose to hit here directly, and it just vanishes off. But it really went here, then went inside, spreaded inside, and came somewhere behind the eyes, and then vanished off. But as Heema madam explains it, she experienced it way beyond it the way. So the opening of channels is still remaining in my case. But at least this channel, from that paper was saying about cavernous sinus and absorption in the jugular vein on all, you can actually feel that it is going in that pathway. And it was on the right side only, not on the left side. So I guess the left side pathway is still to open. Still I need Shodhan in between for left side.
Okay, now there is one buffalo ghee. Now for insomnia we use multiple things. We use Brahmi egret, we use Panchagavya ghee, we use cow's ghee. But in some cases we specifically use buffalo ghee. Now this explanation of why to use which Nasya for insomnia and when and how much, that I'll ask Snehil to explain the specifics, that when it is Vayu Pitta, then what to put, and when there is excessive Vayu and when there is kapha and the sleep gets disturbed, then why to put what. Because we have done a lot of experiments on all the patients and we have come to this conclusion that this is why we put this. So it becomes so easy for you all also to understand that in such cases of insomnia you can use this and why this. So that I'll ask Nehal to explain it.
So to go to that conclusion which Nasya to select, first we need to understand the cycle of sleep, how we divide the cycle of sleep. So we divide in the history taking cycle of sleep into 3 stages. First is the initiation of sleep, second is the continuation, and third is awakening. So when we ask specifically at what time you go to bed, that is a common, I guess, history taking question. How is the sleep? And patient says it is fine, and we close the question. But we go deeper into the question of sleep, that how much time do you take to fall asleep? If the patient is going to bed at 10 and says that I am getting sleep at 11, so there is a 1 hour lag of sleep. So there is a lag of initiation. Generally, patient must go to sleep within 5 minutes max. 5 to 10 minutes is okay. But if there is more, in this time, like 15 minutes, 20 minutes, 30 minutes. Sometimes patient says 2 hours, 3 hours. So initiation of sleep is not there. Then the second part comes is the continuation. So once the patient falls asleep, if it is taking 5 minutes time or 2 hours time, but how is the continuation of the sleep? So in continuation of sleep, is the sleep is sound? Is it shallow sleep, like patient wakes up with a little noise or with little movements in the room or little light? If someone is switching on the light and patient is waking up, the quality of sleep is very shallow. Third point in continuation of sleep is about dreams. If patient is feeling too much dreamy. Fourth is about thoughts. So it is very much different of dreams and thoughts. Dreams are like imaginary and thoughts are active. If patient is under some stress or is doing some job which requires too much of mental functioning, then there will be too much thought process, and dreams will be like inactive imagination. Throughout the day, whatever has happened will come inactively in the mind. So two different things. So four categories in the continuation of the sleep. And last part will be awake. One more part we consider in the continuation of sleep is in the elderly patient, they wake up for passing urine. So how many times? 1, 2, 3, 4. Sometimes yes, patient says 4 times, 2 times. But after that, after passing urine, is patient falling asleep again or not? That is a very crucial question. If patient is falling asleep immediately, that is one part, one situation. Other situation is patient takes time to fall asleep again after waking up. And last part, the stage of the sleep will be awakening. When the patient wakes up in the morning, what is the feeling? Like we generally ask this question very limitedly to the arthritis patient or asthma patient. Are you feeling morning stiffness in the morning? That's it. No, we generally don't ask this question to other people. If patient is coming with abdominal pain, if patient is coming with headache, we'll not ask this question. How is the feeling after waking up in the morning? So waking up and coming out of the bed is two different things. So waking up, जब आँख खुलती है, and coming out of the bed. So we have one patient. We ask him, what is the feeling when you wake up? He says fresh. At what time you wake up? 9 o'clock. But आँख मेरी तो 7 बजे खुल जाती है. तो 7 बजे से लेके 1 बजे. So 7 to 9 is the time where there is a lethargy. Patient is in the bed and just Marathi note just likewise tossing and turning with laziness. So waking up time and awakening time is different. So we tend to ask what is the waking up time and how much time do you feel fresh, or you are feeling lethargy, loss of energy, or you are feeling fresh, or morning stiffness. So this 3-4 questions we ask. Many patients are so much aware about their body, they themselves too tell us that they are feeling lethargic or they are not feeling at all fresh, and they are feeling morning stiffness, not specifically to some joints but all over the body. There may be the swelling over the face and the overall body also. So what the concept Heema madam explains is, when there is when we sleep, when we go to sleep, then the function of Vyana Vayu starts. It goes to the overall body and settles all the functions, and when it come back to its original position, then only the sleep will we will feel fresh in the morning. So every function, like ideally the sleep is the resting phase. So पूरा दिन भर में machine गर्म हो गया है, now the machine needs cooling time. वो ठंडा होने के लिए there is body needs the resting phase, but there is no single system in the body which rests, not even the digestive system. In night also there is a backup work going on inside the body, for nervous system, for respiratory system, circulatory system, everywhere there is a backup system going on. Cooling down of the body is going on. So वो करने का काम is the function of Vyana Vayu. and when this function is complete, then only in the morning you will feel fresh. Just example, we switch on the fan in the night for 6 hours 8 hours, अगर उसको कंटिन्यूस 24 घंटा चालू रखा गर्म हो जाएगा, मोटर जल जाएगी, बेयरिंग खराब हो जाएगी. लाइकवाइज बॉडी में भी वही होता है. So that cooling phase is required, and that is done by the Vyanma. So that is the one part of feeling fresh in the morning. Second, if you have heavy dinner in the night, late in the night, or beyond your capacity of your Agni, then Agni cannot digest that food till the morning. So in the morning, when you wake up in the morning, there will be a rasa shesha jirna, and you will not feel fresh. Third will be the quality of sleep. If patient is feeling dreamy and too much thoughts are there, then the morning when patient wakes up, then patient will not feel fresh, because in sleep two things has to get rest. One is the body and second is the mind. So by default we are resting, body is getting the rest. Second, mind, if the sleep is very much sound and there is no thoughts and no dreams, then only brain will mind will feel fresh in the morning. So I guess it is 10:33 already. If we want need to extend the lecture, or we stop here?
Just I want to add one more line. What Dr. Snehal has explained very nicely and in a very lucid way about the various components of sleep monitoring and how to identify the various aspects of sleep. There is one St. Pittsburgh's index, so we can get it online, and that gives you a standardized tool. And so just one paper, one side paper only. So that also speaks about the same thing, but in a more what we can say standardized way. So those who are interested to go and look that, it is available. It's an available tool and free tool. We need not have to pay for that, so we can take help of that as well. Thank you.
Sir,
So
post
in this
that thing in the group.
So what I have explained is the stages of sleep, just like that. I have not covered the doshas involved, which are required in this. So why the initiation sleep is not happening, why there is a disturbance in the sleep or awakening time. So this is also a part which need to be explained. But if the time permits, everyone is ready, we can extend the session, or we can take in the next session. We can continue in the later part.
I think we should finish this sleep aspect now, because then next time when we will continue, most of them they will lose the connection. So it will be worthwhile.
Sir, I'm also okay with continuation. We can continue.
Okay.
Two people have said continue. What about rest of the people? They need to at least write in the chat box. So we'll come to know. Otherwise, आधे सो गए हैं, ऐसा लगेगा.
Not going for half an hour, definitely, but then within 10 minutes or so, if we can capture those remaining points, that should be fair enough, I think.
I think at least 3 to 5 people have said, let's continue.
Okay. So we'll just see on the initiation part right now. We can finish in 5 to 7 minutes of time. So about sleep, how we get sleep is two things are necessary to the initiation of the sleep. Is one is kapha, second is tamas. So when we read about the vata vruddhi lakshana, it says nidra bhrangsha. When we read about pitta vruddhi lakshana, it says nidra nasya. So what is bhrangsha? Is a break. So if there is a break in the sleep, patient is not able to sustain the continuation of the sleep, then there is a vata vruddhi. If patient is not able to initiate the sleep, that is nidra nash, then it is a pitta vikruti. So accordingly we can select the nasya. Once patient is sleeping, if he or she is waking up in the night for passing urine or with any disturbance and is not able to sleep again, then also it shows the pitta vikruti, because it is a nidra nash. Initiation is not happening again. If patient is sleeping too much, then obviously it indicates the kapha. So this is the three part. Initiation may, if Heema madam can elaborate more.
See, the more the Vatanuloman happens, initiation will be faster and quicker. If the sleep is taking too long, it means Vayu and Pitta are more and the part of Kapha and Tama is less. So now in a patient who has only Kapha little less or Tama little less, and the initiation of sleep is like, say, suppose, say 15 minutes, 30 minutes, then we need to select a nasya. 2 ड्रॉप डाला पेशेंट को नींद आ जाएगा. देयर आर पेशेंट्स जिनको 2 या 4 ड्रॉप डाला आपने पंचगव्य घृत का एंड द पेशेंट सेज नहीं, नींद तो आया लेकिन ना बहुत टाइम फिर भी लगता है. क्वालिटी ऑफ स्लीप हैज इम्प्रूव्ड डेफिनेटली, बट नींद आने में अभी भी समय लगता है. नाउ व्हाट हैपेंस व्हेन देयर इज एक्सेस वात, देयर इज मोर snigdhata required. In that case, I have seen patients, we have put 10 drops, 12 drops, 15 drops, 20 drops, and the patient is in heaven. They need a heavier grip. When there is only pitta, few drops of ghee, work is done. When there is too much of vayu, you need more ghee, more denser material to pacify that. So buffalo ghee, we use it when there is excess vayu and pitta. When there is vayu and pitta equal, or even when pitta is more and vayu is little bit less, that time we use cow's ghee, brahmi grit. This works. When there is three dosha, kapha also. What is Shri Grit, Praveen? I don't know what is Shri Grit. Praveen will throw light on it. Kshirbala 101, it does Shodhan. You cannot put it at night, definitely. Any avartis, if you put, na, they are very sukshma. So if you put any kind of avartis at night for initiation of sleep, it will go in deeper into the srotas and pull out all the even deeper layers of doshas which are lying inside. So you cannot never ever use avartis at bedtime. That will throw out lot of phlegm. Even Puran Grit, never use it at night. If you want to initiate sleep, Panchagavya Grit, cow's ghee and buffalo ghee, these are the simple ones. Even GGS, matlab the Shunti Grit, that also initiates good sleep. Now in patients who have too much of lack of sleep, buffalo ghee is the heaviest, so it gives very good sleep. वायु के लिए ज्यादा घी लगता है स्लीप इनिशिएट करने के लिए, बिकॉज आप 2 ड्रॉप डालेंगे ना तो पूरा सुखा लेता है वो. पित्त में उतने 2 ड्रॉप भी डाले ना तो स्लीप इनिशिएशन होता है, 4 ड्रॉप में भी हो जाता है. बट इफ द पेशेंट से इसके 4 ड्रॉप भी आपने बढ़ाया, 2 ड्रॉप इधर 2 ड्रॉप इधर, स्लीप ओके, क्वालिटी ऑफ स्लीप हैज इम्प्रूव्ड बट द इनिशिएशन इज टेकिंग 30 मिनट्स का 20 मिनट हुआ, ओके, इंक्रीज द ड्रॉप्स, 4 ड्रॉप्स, फाइन, स्लीप इनिशिएशन हो गया, अभी तुरंत नींद लगती है, यू नो दैट दिस इज पित्त. So cow's ghee is working fine, GGS is working fine, Panchagavya Grit is working fine. But if the patient says 4 ड्रॉप में भी स्लीप इनिशिएशन नहीं होता है, you have to also look at the system downwards also. नीचे अगर वायु का अनुलोमन नहीं है तो you put any number of drops, do anything, nothing works. So this is with combination to what is going in the system. 10 ड्रॉप डाले and the patient next day says बहुत अच्छी नींद आई, it means you know that this is vayu. Vayu requires more denser things. Yes, sir. Snehal, if I have missed out anything on this, just say.
So on day one also, if the patient is complaining of severe insomnia, we may think of Nasya or likewise ma'am said. But if the initiation is like half an hour, 45 minutes, if patient is feeling lethargy for 1 hour also, still we would prefer Shodhan Nasya in such cases. See in how much Budshunti Nasya patient is feeling burning sensation, and then only we decide which Nasya to select. It is not just based on the symptoms, but the effect of examination and Nasya which we are putting in the clinic. Then only we finalize the Nasya, which Nasya to give at the home in the home to be used. So understand it is not just the symptom and Nasya, this symptoms and that Nasya, this symptom and that Nasya. It will always change according to the condition. So make a good judgment with the Budshunti Nasya and the patient's condition, and then only come to a conclusion. This was a very small part of initiation of Nasya. In initiation of sleep and Nasya, we may, if time permits later, sometime in next sessions, coming sessions, we may explain more about continuation of sleep and awakening and relation of Nasya with that stage of sleep.
सर आता वाइंड अप करूया अवधूत.
Yeah, I think we should now
Yes, yes.
wind up. 10:40. I should once again say that today's session was really great. All of you have done great justice to this particular subject, and with a very specificity, because usually when we go through this Nasya Prakaran or these Kalpas also, we never see that kind of specificity with reference to Samprapti and with reference to doses also. So in this today's discussion, what we could see, the very typical focus on uh, what kind of preparation to be used, when it is not to be used. All those aspects were dealt in a great details and in a simpler manner. So I think well done. Thank you everybody.
Thank you, sir. Thank you.
Thank you, sir.